Hi everyone, Steve the Hurricane here. I am very excited to be sharing this with you, overcoming the caregiver crisis. Everywhere I go, all across the nation, when I'm speaking at stages and conventions, when I'm at association meetings or franchise meetings, talking with other support business owners like my company, Hurricane Marketing Enterprises. We're a support business. I talk to people from My CNA Jobs, Home Care Pulse, Clear Care, and a plethora of other companies that exist out there, IPC Ed. As I talk to them, the biggest challenge that all home care owners across the country, even internationally, are discussing is the crisis of the caregivers. And what are we going to do? How can we overcome the crisis of the caregiver? And so I put together a couple of things here that's going to really be able to help us to overcome the challenge of finding caregivers and retaining caregivers. And I'm going to point out some things, and I know a lot of times when I talk, I'm very real. And I hope that you appreciate that I'm real with you. I put down in the questions, if you want me to be real with you, please type yes in the questions pane, because I want to be real with you and just talk straight from the hip with everything, from my heart to you, because some of the things that are happening, it's our fault, and that's what we have to overcome and realize. So I'm going to point it out, and I'm going to point it out not just from, oh, shame on you, home care companies. No, I did the same thing, because remember, I owned a home care business too for 8 years plus. So I know exactly what you're going through, because I've been there myself, and it wasn't until I made certain changes in my business that the entire business overall changed. So, I want you to think for a moment here. Have you ever, well, first off, special thank you to Home Care Pulse. So remember I talked about stats and how I like to show real stats, proven methods, things that are working. Everything that I'm going to talk about today, so that you may know me, you may not know me. I could just be some guy that you saw something on Facebook, or somebody said, oh, I'm going to watch this webinar. That's fantastic. So you have no idea who I am. I back everything up with facts. Home Care Pulse, the benchmark study of the private duty home care industry. This is basically like an encyclopedia or an almanac of our industry and what's going on. So they surveyed over 1,100 locations, coast to coast, and some international as well. And so all the stats I'm going to show you are from this report. So a very special thank you to Home Care Pulse. And I want you to think for a second to yourself, have you ever wondered what it would be like to have so many caregivers working for your organization that you don't have to worry and stay awake at night wondering if that caregiver is going to show up because you have such good quality caregivers? Have you ever wondered what that would feel like to yourself? I know I have, folks, and I've actually been in that situation where I've had the best caregivers that I could go to sleep at night because I wasn't worrying. But for a lot of people, it seems like a dream. Now, would you like for me to share with you exactly what we have to do in order to be able to overcome the caregiver crisis and not just hire more caregivers, but retain the caregivers that we hire? All right, because you see, you're about to discover right now exactly what it takes to be able to confidently increase our rates, because really that's where it comes down to. We got to pay the caregivers more, but we're afraid to pay the caregivers more because we're afraid that somebody down the street is going to charge less and we can't close that client. That's really one of the challenges. So you're about to discover exactly what we have to do so that you can have so much referrals coming in that you can increase your rates confidently and close and take care of fewer people with greater needs, therefore increasing your revenue, your profits, and giving the caregivers the cases that they want so that they stay with you for the long term. I had many caregivers work for me for years, not a couple of weeks, not a couple of months, for years, 5+ years, same caregivers. Why? I'm going to go over that with you right now. And my promise, by the end of this webinar here today, I'm going to give you an entire marketing plan. A marketing plan is going to be designed to make your phone ring off the hook so you have an abundance of referrals, because when you have an abundance of referrals, then you can almost quote-unquote cherry pick. Not that you want to, but you have the ability to do that and take on the clients that you want to service, and then the ones that you can't service or the ones that you don't want to, you can give it to somebody else. Because I do believe in paying it forward. I do believe that if somebody contacts you and you can't provide services, give it to your neighbor down the street. Give it to your competitor down the road, because we're all in this together. It's all about providing the best quality of care. Because you see, there's a big problem out there today. As a home care owner, and type yes if you agree with what I'm saying on this, okay? Here's a problem. We have government, and whether you're Republican or a Democrat, it doesn't matter. You probably aren't too happy with the government right now. Because what does the government do? They give us compliance. right? And the healthcare industry, more than any other industry, is so full of compliance, and it's good that they have compliance. It's checks and balances, I get it. But when you have so many compliant challenges, that reduces your profits. And because you have to have a compliance officer and you have to be worried about the state walking in and getting surveys and all the other things that we have to deal with, that takes money out of the business, which is a problem. There's the labor law problem. Type yes in the questions if you agree with what I'm saying. There's a labor law problem out there. Everybody's worried to death about this $15 an hour. I see people saying true, agreed, yes, heck yes, Edwin, right? There's the labor law problem that's out there. Everybody's worried about the $15 an hour. In some areas, it's already $15 an hour, and it's going up. Now, that is a problem. On the flip side, just to be all fair to our caregivers, it is a tough job being a caregiver. So it's almost like a double-edged sword. I would love to give my caregivers $15, Steve, because they do work hard. They're deserving of it. But how am I going to give them $15 an hour? We're not able to charge enough money to be able to do that. That's the problem. That's the biggest problem. We don't have the closing strategy, the closing technique to be able to increase our rates so that we can confidently close at the higher rate and pay our caregivers more. That's the problem. I identified it right there, right now. The other thing that I'm going to add to this too, which is a problem that's becoming more and more of an epidemic, you look at the skilled nursing facilities and the places that hire CNAs. They're hiring our caregivers. They are. And they have deeper pockets than we do. They get very high reimbursement from Medicare and insurance, and so as a result, they can pay caregivers the $15 an hour that we can't do it. So they're snatching up all the caregivers, and as a result, because here's the other part of it when it comes back to closing, it all comes back to closing. We get a client who says, I want an hour a day. I want a bath visit once a week, twice a week. Say yes if you've ever heard that before. Just type yes in the questions if you've ever heard that before. Because I know you've heard that before. The yes is blowing up. Yeah, that's what 1 hour. That's what 1 hour. Again, it comes down to closing. Do you think a caregiver wants to work 1 hour at a client's house every single week? No. It's not worth it to them. They would much rather work at the rehab center, get $15 an hour, and have 40 hours plus of consistent, steady work. So therefore, they don't want to work for the home care agencies. This makes sense. So we need a closing process to be able to go in and not just sell a client what they want, because does the client really know what they want? No. The client doesn't know what they want. The client has a need. If they called you and they have a need, they just came out of a hospital, out of a rehab, and they say that, oh, I only want an hour a week, if somebody calls you for an hour a week, don't even sell that person services, because that's not going to help them. That's not going to make a difference. You're not making an impact in that person's life. That's part of the problem. And it leads to service failures. It makes your agency look bad, and therefore it makes our industry as a whole look bad. Do you understand what I'm saying, folks? Just type yes if you understand. This is the problem. It's not even a problem. I have it read here because it's a freaking crisis. It is a crisis. So that's exactly it. Dawn, I see that. That's right. So here's what's going on. So how do we overcome this problem? If you look at this, and this is not just a problem, and you see it right over here, this is straight from the Home Care Pulse. When they surveyed people, this is the 2015 one right over here, 62% of the agencies, 62% of the industry, the agencies out there said that their biggest challenge, that they're the most worried about, is caregiver shortages. So I know I'm preaching to the choir here, and you agree with me on it. So here's how we move forward from it. If you look at this, I talked about the price, right? We got to increase our rates, folks. This right over here is straight from the Genworth Financial report. I love the Genworth Financial. Here's the average cost coast to coast right now across the United States of America. It's $19 an hour for a home health aide, and it's $20 an hour for, $19 for a homemaker and $20 an hour for a home health aide. But the staggering number on this, folks, and this is facts. This is why I'm saying it. Look at the 5-year annual growth, 1%. Now, I don't know about you, but I don't know anything that costs 1% more today than it did 5 years ago. I don't know anything. So when I see this, and here's my state, my beloved New Jersey, that's where I'm from. Even my state, 5 years ago, the price was pretty much $21 for a home health aide and $20 for a homemaker. And this is what scared me. This is how I know we can't close, because we're frozen at these rates. We're not increasing our rates, but compliance, labor laws, everything is eating away at our profits, and many of us are closing down our businesses. That's the whole problem right there. We can't close. So because we can't close, we're not raising our rates because we're scared we're going to lose people, and so therefore we're not growing our business. It's as simple as that. Now, who am I? Yes, I'm Steve the Hurricane, okay? But it's not a self-proclaimed name. Brian Macklis, he was my old boss, I became his business partner in 2009, and we owned a company called Care Choice, and he nicknamed me Steve the Hurricane in 2006 because I'm a very passionate, energetic guy. And so I've done this. I've been in the healthcare industry, home care industry now for 11 going on 12 years. I have done this firsthand, walked into referral sources. I've had doors slammed in my face. I've been escorted out of hospitals. Type yes if you know what I'm talking about, okay? I've had social workers tell me, oh, I'm giving out your flyers. I'm giving out your brochures, and the phone doesn't ring. Yes, you can go ahead and type yes if you know what I'm saying there, all right? Positively, in the last 4 years at Hurricane Marketing Enterprises, I've trained hundreds of home care companies. I have spoken at enough conferences to more than thousands of individuals on how to develop referral sources, on how to increase their census, their revenue, and their profit. I freaking co-authored the book with Valerie Van Boeven, and the marketer said, let there be leads. And I have hundreds of videos on YouTube. I know what I'm talking about. This is what we got to do. And this is my story. You know, when I came into Care Choice, it was 2005. It was August 15, 2005. And when I first came in there, I did not know healthcare. I was what I call a healthcare moron. Yes, some of you have heard the joke, the acronym ADLs, Activities of Daily Living. When I heard ADLs, I thought that was Lou Gehrig's disease. Yes, that is a fact. For 6 months, I thought it was Lou Gehrig's disease until I realized when a therapist was talking to me about someone's ADLs, and I was like, oh, that poor person. They're ADLs, and she's like, what are you talking about? And I'm like, that's not Lou Gehrig's disease, and she's like, ALS, and I was like, oh, okay. So that is a true story. But my background was pastoral. I went to school to be a minister, and sales and marketing. And when I came in to Care Choice, I looked at our prices, and we were charging below average prices. We had no minimum of service, so we had all of these clients. We didn't even have all these clients. What am I talking about? We had 16 clients that we were servicing. You could type yes if you know what I'm talking about, where you've been in business for a couple of years and you only have a handful of clients. We had 16 clients. We weren't doing very well. Brian was scraping to get by. He had been stagnant for a couple of years. We were undercharging for our services, couldn't pay the caregivers, desperate to get work for people. We had every government assistance program out there that we could offer, which gives you even less of a reimbursement than our rates were. So we were struggling when I came in. And that's when I came in and I sat down and I looked at our sales process. I said, do we have a sales presentation binder? Do we have a sales process? And Brian goes, a what? And I said, oh, man. So I wrote a sales presentation binder. I said, where's our inquiry management, our inquiry form? Do we have an inquiry form and an inquiry process? And he's like, a what? And I was like, oh, okay. So I created that too, because that's sales. That's my strong suit. And so I started to work on that. But the other part of it, which a lot of people don't realize, is you need your phone ringing off the hook. Okay? You need your phone ringing off the hook. And some of you have already heard me present before other topics. You know I always say this. Referrals equals freedom. Referrals equals what, everybody? Freedom. The more your phone is ringing, the more you can control the way you do your business and who you work with. Because if you only have your phone ring once or twice a week, you're going to smother that client, that prospect to death because you're desperate for the work. But if your phone is ringing 10, 15 times a week, you meet your people, you do your inquiry management process, setting up a time to meet with them, you go sit down and you talk about your services and you discuss it with them, and then you close them. And if your price is a little bit more than they're willing to spend, then they can go leave and they can go work with somebody else who's going to not take care of them, who's going to give them poor service because they're not paying their caregivers. The caregivers aren't going to show up, and you don't have to deal with that. That could be someone else's problem because you are going to do the right by your clients because you're working with the people that you want to work with. It all comes from referrals, okay? The more referrals we have, the better our business is going to be, okay? Now, we have some challenges, okay? Going into a referral source is not easy. Asking a social worker to refer us when there's 100 other competitors in our marketplace and she doesn't understand home care, type yes if you've had a social worker say to you, oh, I know what home care is. Just go ahead, type yes in there. Go ahead, type yes. Because you know what I'm talking about. Oh, we know home care. Unless that social worker actually worked in home care, she does not know home care. But she doesn't want to talk to us. And truth be told, she doesn't have time to talk to us because she's inundated, she's overworked, she's undercompensated. We have to overcome this. We have to get the administrators in the skilled nursing facilities to understand the role that we play. But that's a challenge that we have. The home health counterparts, the hospices, they should be referring as power partners. But again, that's a challenge that we have to overcome. Steve, this is a lot of work. This is hard. Well, I'm going to tell you right now, another challenge, folks, is ourselves. We as ourselves, as business owners, it is hard to be a business owner. Understand that. Yes, it's hard. I own a business. I've owned businesses. It is hard. But anything worth having is worth working for, is worth fighting for. Risk, reward. So these are the challenges that we have to overcome, and that's what I'm going to go over, and I'm going to give you all this stuff. And this is why I created the Profits Workshop that I'm going to talk about. It's on August 4th. It's going to be in Newark, Delaware. And I'm going to talk about this a little bit more at the end, but I put this together because a 45-minute webinar, I can't give you everything. But that's why I created this workshop. We actually did one in New Jersey in December, and it sold out in an hour. In an hour, it's sold out. It's ridiculous. So like I said, I would love to have everybody on here come to this, but we physically cannot have you come to this because there's just not enough space. So if you want to do it, we'd love to have you, but again, we can't have everybody on here. And the bigger reason why I did this is because I'm trying to help you help your patients. You know, I'm in the process of creating with my staff a nonprofit organization. I'm not going to go into too much details, but the nonprofit organization is designed to help our elderly stay out of the hospitals and stay home where they want, stay out of the nursing homes and be home where they want. That's what I'm passionate about, is helping people stay home. And I hope, as a home care business owner, you're passionate about that too. But let me tell you, folks, time is running out. The clock is ticking. We must take action right now, today, if we want to be around in a couple of years. Because if we don't make changes, a few years from now, we'll be gone. Those that don't adapt and those that don't change will not be around. So some more stats for you here. How much is one client worth? Now this is, I love, this is straight from Home Care Pulse. Added up, divide by 4, basically comes up to about $11,500 per client. So one client, financial value, because you can't put a dollar on someone's life, but financial value is $11,500 per client. But notice how agencies that are smaller, that are doing less in revenue annually, have a lower lifetime financial value of a client than the agencies that are doing over $2.5 million. I know what the answer is as to why that is. The answer is it's where they're getting their referrals from. The answer is it's how they handle their inquiry management when someone calls in for services. The answer is it's their closing process and selling their services, but it's not selling, it's giving somebody what they need versus what they want. If you ask a senior what they want, they don't want care. But if you ask a senior what they need and they start telling you what they need a lot. And in order to stay home, this is what it's going to take. The bigger agencies have the sales process. That's why I created this workshop. Now, as I move forward, when it comes to making the phone ring, because Steve said, you know, I got to have more referrals. I got to have more referrals. How do I get more referrals? There's only 2 ways to get referrals, and everything else is not worth it. Drop the direct mailers. It doesn't work. Don't advertise on the radio. It's too expensive. Television ads. Ask some of the bigger franchises how successful their television ads are for the individual franchisee. Maybe for the franchise as a whole, it's successful, but for the individual locations, not that effective, but it costs millions of dollars. There's only 2 ways to really grow your business: online leads and direct referral marketing. Online leads, that's not my area of expertise, but you want the 1-2 punch. The bigger agencies out there, the ones doing over $2.5 million a year, which when I look at the agencies across the country, we're talking about less than 20% of the agencies are doing that much revenue, so that means the majority of us are not doing that. They have both going for you. So I'm going to talk about the direct referral marketing. And as I move forward with it, look at this again. Look at the number of inquiries that the bigger guys have versus the little guys. The little guys get basically a referral every 2 days, or a referral every 3 days. A referral every 3 days when you look at the little guy. You look at the guy who's doing between $800,000 and $1.5 million, that's a referral every other day, every 2.5 days. Then you look at the agencies doing $1.5 to $2.5 million. Yeah, they're getting a referral pretty much every day, maybe every other day. And then look at the leaders, how many referrals they're getting. And they're doing over $2.5 million a year. It's because they're getting it from everywhere. And what was the biggest opportunity of the 1,100 agencies surveyed? The number one opportunity from growing their business came from strengthening relationships with referral sources. So, is strengthening our relationship with referral sources important, folks? Type yes. Okay, good. Yes, 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 yes. It is just flying up. Okay, so now we got it. So now, the next thing we got to do, where do we go? Well, these are our referral sources. If you're doing good, you're going to get referrals. That's automatic from our past and current clients. But we got to get home health, assisted living, hospitals, hospice, skilled nursing facilities. Another place on here, a rehabilitation hospital like Health South. And then you have healthcare professionals, those CCRCs, continuous care retirement communities. You can throw in geriatric care managers. They call those folks power partners. And yes, even the government Medicaid program, although because of the labor laws, we talked about that before, Medicaid is basically done. So you don't really want to focus on that because you're not going to make any revenue and your business will go out. So you want to create a top 20. For those who don't know what a top 20 is, it's basically 20 accounts that you're going to focus your effort on. You want it to be a couple of each of those different types that I mentioned before in the last page, so that this way we can focus our efforts developing a relationship that leads to know, like, and trust, because people refer you when they trust you. When it comes to private duty, don't believe the smoke and mirrors, oh, patient's choice. No, the social worker is going to refer. You like that? You like when I do the voice? I know a lot of people like when I do the voice. Oh, patient's choice. That's the annoying social worker who won't refer us. That's what she says. You know that social worker refers who she trusts. When it comes to private duty home care, if somebody's in a hospital, think about it this way. Somebody's in a hospital, and they're in that hospital bed, and they're told that they may need home care, and then they get a list of 15 home care agencies, and they have to call them before they get discharged home, so it's a safe discharge. What, is that person going to call all 15 of them? No, they're going to say social worker. Who should I call? I don't have time to look at this. Or a son or daughter who's out of state? No way. The social worker is referring somebody. It's just not the people unless you're the one getting those referrals, which most of us are not. And that's why I'm here. So I want to share something with you. This was from a convention I was at last year. Susie came to an event, like a workshop. It was a pre-conference workshop day. Went over a whole bunch of different stuff, including talking about power partners. Went out within 6 weeks, went co-marketing with a rep from Vitas Hospice, got into a hospital, started getting referrals 6 weeks after leaving the program. Already started increasing her referrals. Thank you, Susie, for writing this. And you can see this on my website right over here, because testimonies speak to the truth that it works. Now, this is a formula for success. I want you to write this down. Every single week, you want to see 35 to 45 people face to face, because those are the times, those drop-by visits, that's how you develop a relationship that leads to getting referrals. Every single week, you have to do one lunch and learn in service. If you could do more, great, but you got to do at least one every single week. You want to attend one networking event every single week. This is where you meet people who can open doors for you. This is where you can get prospective clients. Everything comes from those networking events. You want to go to one CE, continuing education, or a community event. What I love about CE is I actually have a client, Roy, who's not, I don't have his testimony here, but he's here in New Jersey, and I love Roy because Roy, after he went to a workshop, he came to a boot camp, he went back, he invested in the coaching programs that we have here, but he went to a CEU event, He was the only home care company there with 15 social workers who were present. He hit it off with one of those social workers, so much so that the very next week he had lunch with her at her rehab center, and then after the lunch meeting she gave him a 24-hour live-in client. And then fast forward a year later, he's received about a dozen or so 24-hour live-ins from that one social worker, all because a year ago he went to a continuing education community event and met the social worker, and then he booked a meeting from a meeting. I mean, I can't say it enough. It is really that simple when you know what you're doing and you know how to do it. And in the last one essay is one sponsored activity at an assisted living, an independent living, a nursing home, a CCRC, something of the above nature. If you do this every single week, I promise you, you could be the worst marketer in the history of humanity. Not the world, humanity, the history of humanity. You could be the worst marketer in the history of humanity, and you will still get referrals. Do you like that? Yes, type the yes. That's right. That's what it's all about. Get those referrals, because the more referrals coming in, then you can increase your rates. What does it take to be good at direct referral marketing? Relationship building. That is, if you're married, type yes. If you have been in a relationship, type yes. If you have a friend, type yes. So everybody's typing yes. I see these yeses coming in. And I know it's a little sarcastic and I'm being a little humorous with you, but don't mind me. I didn't get home until 3 o'clock in the morning. I was having a terrible travel time yesterday. But I'm loving this because it's the truth. That's what we have to do. We have to develop a relationship. Now, individual character and talent, that's God-given. Some of us may not have all of that, but if you get the other things up here, you can figure it out. Consistent follow-up, that just means you're persistent. And you come back again and 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 again. Can you do that, folks? Yes. And then finally, your ability to communicate. Let me ask you, can you speak English? If you can, then you can communicate and you can get referrals. That is what it takes to get referrals. There we go. Let me tell you about Bookham Dano. Bookham Dano is one of my favorite clients. He had the personality, the X factor. He came to a private one-day workshop that I did out in Southern California with him and several other owners out there, and I went over the inquiry management process, and I went over the art of closing process, and I went over how to make the phone ring, all the things that I'm going to do at this workshop, and he took everything, went out and executed it with his charming personality. Bookham Dano is his own. He already had the nickname. He went out there, and he's dominating it. He's killing it. And you read everything that's on here. He'll guide you step by step. He had the personality. All he needed was the way. I showed him the way. He went out there, and he's dominating his market. And again, this is another testimony you can read from my website. Now, I'm going to give you right now what I call the core four. Because what people don't realize is, like, Steve, it sounds like a lot of work. I got to manage 20 accounts, blah, 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 blah. What you have to do is you have to go in the 20 accounts consistently. When you go in the 20 accounts consistently, this will allow you to be able to get what I call the core four, and you get 4 accounts to refer you. Every referral that they've got, and you're sitting pretty. I'm going to show you right now how you can bring in $1 million the rest of this year. Would you like that? Yes, $1 million of new revenue that you don't have right now later on the rest of this year. Would you like that? Good. Okay, well, I'm glad to hear that. So now, as I see the yeses coming in, one home health agency maintaining about 100 clients in their census can easily refer you 5% of their, because we're talking about 100 clients in their census. Average length of stay is about 60 days, so we're talking about 500 patients a year. 5% of that is 25 to 30 clients annually. There's 25 clients right there. Now, 25 clients times $11,500, as I talked about before, that's over $250,000. Okay, just remember that. Next, one hospice, same thing, maintaining a census of about 100 clients. Average length of stay for hospice, folks, is 18 days, so that's actually a little bit more, but we'll just go with 100 clients on their census. That's about 500 clients a year that they take care of. 5% of them, that's all we're asking for, because not everybody's going to need it. 5%, that's 25 to 30 clients. There's 50 clients, you're at $500,000 a year already. Then one CCRC. The independent side gives you 5 to 10, the assisted living gives you 5 to 10, and the skilled nursing gives you 5 to 10. In total, 25 new clients from that one CCRC at 75 on the year, which is close to $800,000, $825,000 at this point, with $11,000, $11,500 per client on average. So you just follow me here, 3 referral sources, and let's give you one skilled nursing facility that's well qualified, that's discharging 50 patients or more a month. Yes, they exist in all markets in the United States. There may not be many of them, but there are those that exist. If you get 5%, that's one client every other week. There's 52 weeks out of the year. That's 25 to 50 clients a year. Now you have 100 clients, and 100 clients which will give you $1.15 million a year. That can be done from just 4 referral sources, and I got testimonies galore on people who loved it. And by the way, I didn't even talk about hospitals, because you don't need a hospital. That's something a lot of people say, I want to get into the hospitals, I want to get into the hospitals. I say, well, what's your business right now? Oh, we did $250,000 last year. Okay, you're not ready for the hospital. You can't handle hospital discharges. I don't really recommend somebody getting into the hospital until they've been in business for at least 3 or 4 years. they're over $1 million, means they're a 7-figure business, because then they can handle hospital discharges. Because if you get into a hospital, you know what's going to happen? They're going to refer you same day. They're going to refer you at 11 o'clock in the morning, and you're going to have to take that person home at 4 o'clock. And if you can't do it, you're screwed. So I don't recommend going to hospitals until your business is at a point where you can handle same-day discharges. Get the operations down. Go to the other referral sources. Grow your market. And what's cool is when you grow your market first, so let's say you're following me here. You get those core 4 going, those 4 accounts that can refer you business. Then all of a sudden, a year goes by, you bring in your $1 million of new revenue, and then all of a sudden now you're ready to go into the hospital. But guess what? You have an entire community of people that the hospital refers all the time, already referring you. You can leverage that relationship to get into the hospital faster. But one hospital discharging 200 clients per month, which is 2,400 clients a year, very common. That's not a big hospital. Many people, I work with clients all across the country. Many of them deal with hospitals that discharge 3,000, 4,000, 5,000, 7,000 clients a year. But 2,400 clients, easily 5% is 10 referrals a month. You're talking about 50 to 100 clients a year just from one referral source in the hospital. You put that together with your other core 4, you're looking at 150 to 200 new admissions a year. Now you're the big boys, just like those leaders who are bringing in the 500 referrals and their business is doing over $2.5 million. Yeah, this right here is almost $2.5 million in new revenue, folks. It doesn't get any, it can't be done any slower. I can't show you any other way except for through that right over here. And then boom, real quick, you take a look at this. This is where you qualify your referral sources. How often do you have to go there? You want to base on their potential to refer you, all the other good stuff. I always talk about that with my clients on a regular basis anyway. This is Rick from California. I love Rick. I met him in 2013. I did a private workshop training with him and several of his people in Northern California. And as we were talking, you see, my clients love me, and I love my clients. You know why I love my clients? Because when you know what you're doing and your business grows by 25%. Now he was already doing $2 million when he started with me. 25%, that's $500,000. When you know what you're doing, you're working smarter, not harder. You're working more efficiently. You're taking on fewer clients with higher revenue coming in, and your life is easier. You love it. This is a picture of him in the Grand Cayman Islands wearing my shirt that I gave to him because he was just doing such a good job, and he's all proud. He's like, look, he's blowing away the competition. You see it on the back here. His business grew in 25% in 6 months. 25%. That's $500,000 from what his business was doing prior to, on top of what he was already doing. And he started with a train. 4 from my office did a training with Steve in that September. A training, a workshop training. That's exactly what he did, and his business started to grow. And he learned, he got every tool he needed to be able to get out there and start blowing away the competition. Now, this is the mistake that people have, right? I need caregivers before I market. I hear this every single day, and I'm sure many of you have said this. I got to have caregivers before I can go market, because if I don't have caregivers, I can't market. No, that is a mistake. You must recruit simultaneously, because here's what happens. If we recruit and we don't have business to give them, then you don't have a caregiver, because when you call that caregiver 2 weeks later to give them a case, they're already working for somebody else. So you can't do that. It must be simultaneous. I would almost rather you market before you get caregivers. I would rather you market before you get your license, because what happens if you get a referral? Because it takes 3 months to get referrals. People don't realize that. It takes 3 months. So if you get a referral before you have your license, what do? You give it to another agency. That's what you do, because you're starting the process. If you can't staff it, you give it to another agency. You don't give the service failure. The universal reward is called good karma. Pay it forward. It'll come back tenfold. I promise you on that. But if you wait until you have caregivers and then you market, you're not going to have caregivers. So it must be done simultaneously, or really, marketing is the most important thing you got to do. You got to make your phone ring. Then you're going to have your ads. We all know about ads. I like to do employee bonuses. We did employee bonuses. Now, I want you to think, how much does it cost to get a caregiver? When you look at your actual cost, it's about $500 to $600, and that's also in the Home Care Pulse report. I didn't put that in here, but that's in there somewhere. It's about $500, $600 to acquire one caregiver to actually work for you. So what I recommend is take half of the cost to get one caregiver and give that as your employee bonus to the people who work for you. So if your caregivers give you a caregiver and that person starts working for you, give them $250 to $300. That's a huge bonus. But a lot of agencies do $100 or $50. That's not a lot of money in today's world. But $250, yeah, your caregivers are going to be very excited about that. We actually had one caregiver, I'll never forget, Sala was her name, S-A-L-A. She was from Ghana in Africa. I love Sala. Miss Sala, Miss Sala. Oh, Mr. Steve, thank you so much, thank you so much. Sala in 1 year made $7,500 just on caregiver bonuses because she referred so many caregivers to us. And when you have that many caregivers working for your agency, working with clients that are giving you $11,500 per year, those caregivers probably brought in around $700,000-800,000 in revenue from the work that they were able to do. So that $7,500 I gave to Sala was worth its weight in gold. It was like 1%. So it really, really is totally worth it, or 10%. Employee bonus, right? I said that already. The one caveat what you want to do with that is you want to make sure that it's attainable. 90 days is not attainable. Make it 2 weeks. Make it 80 hours, something of that nature. And then obviously you want to put out flyers. Once you do all of this, folks, then what I want you to do, increase your rates. Please, increase your rates. Now, remember I told you I'm going to share a testimony. I'm going to share my own testimony before I share some more testimonies because I love testimonies. But, and you can read this one right over here. This is another client in California who engaged services with our company. As you read that there, I'm going to talk to you about what happened with me. In 2011, after we had sold our business to the corporation, we had so many referrals coming in. Remember, I was bringing in like 40, 50, sometimes 60 referrals in a month. In a month. That's half of what many agencies do in an entire year. We did it in a month, right? I was good at this. Because our phone was ringing up the hook, I'm sitting there, we could not staff cases. We couldn't staff it. We couldn't get caregivers enough. No matter what we did, we couldn't get it. I just went crazy. And we were already charging more than everybody else. Because remember I showed you at the beginning of this webinar, the average price in New Jersey was $21 an hour. I was already charging $22.50. So I was already $1.50 more than the average. And if that's the average, what's the low? $17? So I'm already $5.50 an hour more than the low person. And I said, you know what? Screw this. Our phone is ringing off the hook. We can't staff it. Obviously, it's supply and demand. That's the whole purpose of what I'm talking about here. We are the elite. We are the best of the best. I'm going to increase my rates. And I did. I went to $23.50. Now, I still wasn't the highest in the area. The highest in the area at the time was $25. But $23.50 is high. That's not even average. The average is $21. So I'm now $2.50 over the average. I'm sitting down with families, and they're asking me, can you do better on the price? And you know what I'd say? No, I can't. But somebody probably told you we're the best. We are. We are going to take excellent care of your mother. And then the family goes, okay, thanks. And then they sign on the dotted line, and we provide the care. That extra $1 stinking an hour allowed us to give the caregivers just enough money to recruit more caregivers, keep them happy. We're giving them 40, 56 hours a week of work with overtime and everything. We were able to do it, but we were able to keep our margins where we wanted them to be. We were able to grow the business. We were able to attract more caregivers. Our caregivers were referring people to us. That's the good life. And that's a $5 million plus a year agency, folks. That's what it takes. That's what can be done. You can do this. You just have to take action. You got to do it now. You got to make the commitment now to yourself because you know it's worth it. For your family, for your livelihood, and also for your patients. You know that you have to do it because if you go out of business, everybody loses. So you have to be able to do this to stay successful. This is what Carrie has said. I love Carrie because they're actually in California, right? But they aren't in California. So they actually had us come in and work with their staff while they were in Florida. It's an amazing story. So they weren't even there, and we helped them grow their business. They were at 3,000 miles away in another state. I love this one right over here, Tyler. He learned about the Power Partners. I love this. Came to a workshop day. This was Tyler was at he was actually at a boot camp. And I talked to him about the Power Partners. He went out there the very next day after getting introduced to a social worker. He got his first referral. Your method just plain works. And I have countless others. But I promise you I try to keep it to a certain time limit, and we're at 45 minutes. I'm going to tell you about this workshop. Again, we can't have everybody come to it. I'd love for all of you. There's over 100 people on the webinar now. It's not going to happen. I cannot take all of you. The space It's going to sell out. It always sells out. They always sell out. It's amazing. But this is the benefit. I'm going to talk about how to help you convert more clients. Why? Because we want to convert more clients. How can we increase the hours, and not just the hours of the entire agency, but the hours per client? Because when we have our clients getting more hours per client, the caregivers want to work it. They want 4-hour shifts, 6-hour shifts, 8-hour shifts, 12-hour shifts. They want that kind of work. That's what the facilities give them. So I'm going to train how to help you get clients to take those hours so that you can staff them, which will help you to then recruit more caregivers, because I'm going to help you to be able to increase your rates to where they need to be. It's the whole focus of it. It's the Home Care Profits Workshop, okay? It's the Profits Workshop, which then, when everything comes together, you're going to be able to make more money, which is going to help you and your family and everything else, because this is why you started your business. I know we're all caring people, but you also have to keep food on your table. You're going to be able to live the good life as you always wanted, the American dream, and you're going to be able to help more people, because when you do it right, people are going to want to go with your agency. When people go with your agency, you're providing the care, you're fulfilling your mission of keeping that senior home, aging in place with dignity and grace. That's what the workshop is all about. So you have my permission to call my office and sign up now, and guess what? These workshops, people do these workshops all the time. These things are hundreds of dollars. And I say hundreds of dollars, I mean like $500, $600, $800, something of that nature for this. Boom. My thank you to you for being on this webinar with me right now. It's only $199. That's right, $199. That's all it is. I think we have a spot for like 10 people. There's 100 of you on there, so like I said, I would love for you all to be there. It's not going to be able to happen, though. Call my office. Take care of it. Here's our phone number. You can take action. Right now you can call them. I know the people in the office are ready for it. It's 848-444-9865. Again, it's 848-444-9865. It's August 4th. If you're in the area, you don't even have to stay over. You drive. You come to the DoubleTree. You learn how to increase your census, your revenues, and your profits. Go over the closing process. Go over the inquiry management. Go over how to make the phone ring more and recruit more caregivers and keep your business going. Take action now. Call. Again, this is everything that's on here. Space is limited. I don't even know why I put that in there, but it is limited because we don't. It's a tiny room. It's a workshop. It's going to be one-on-one role playing with me and my staff, and that's what you want. You want to role play this out so you actually walk out with something concrete and you can go back and execute that. So that's what it's all about. That's why I do these workshops periodically. Haven't done one since December, but it's August, and I just wanted to say hi. So we'd love to have you there, but again, space is limited. We can't have all of you. Take action. Here's our phone number, 848-444-9865. And again, here's all the details for it. It's August 4th. It's going to be at the Newark, Delaware DoubleTree Hotel, which is there. And again, you're going to learn how to increase your referrals, increase your rates confidently, increase the closing ratios, get more referral sources, and then help to increase your recruitment retention. And by the way, anybody who's ever been to anything that we've put on, you're going to have a lot of fun. We're going to have fun, and then I'm going to help teach you how to blow away the competition, help you fulfill your mission, keeping our seniors home safe, aging in place with dignity and grace. That's what it's all about. So, folks, I thank you so much for your time. You can call the office. Again, there's the number. I'm going to leave this up there. God bless each and every one of you on your mission, on what you're trying to accomplish. I'm proud of you. I cannot wait to share the full details on the nonprofit that's coming, and it's a lot of work, but it's worth it, because if we can help our people stay home as an American, as a man of faith, as a person, it's really about helping individuals. The money comes when you put the care first. That's what it's all about. So, you're on the front lines every single day. Thank you for what you do. Thank you for your time. I appreciate you. I know I always get these great, Steve, you're wonderful. We love you. You inspire me, because I know what it's like. I know how hard it is to do what you do. I'm here to help you. I would love to meet you. I'll see you soon. Take care.